Welcome to Nevada Orthopedic and Spine Center. In this video, we will guide you through the proper steps to apply and care for your knee surgery collagen dressing, ensuring a smooth and effective recovery. Start by washing your hands thoroughly with soap and water. Prepare your dressing supplies, which include your primary collagen dressing and secondary adhesive dressing. Ensure the area around the surgical site is clean and dry before you begin. Carefully remove the old dressing, taking care not to disturb the wound. Dispose of the previous dressing properly. As you remove it, check the surgical site for any drainage or signs of infection, such as increased redness or swelling. Take your primary collagen dressing and gently place it over the surgical site. Make sure the dressing fully covers the wound area. The dressing should fit snugly, but not apply pressure on the incision. Now apply the secondary dressing to cover the primary dressing. If your secondary dressing has an adhesive edge, peel back the release paper carefully. Center the gauze pad over the primary dressing and press the adhesive edges gently to secure the dressing in place. Ensure that the dressing is secure, comfortable, and not too tight. The dressing should stay in place without shifting. Change the dressing according to your healthcare provider's instructions, typically every 24 hours or if it becomes soiled. By following these steps, your incision will heal effectively, and you can monitor the wound for any signs of infection. Nevada Orthopedic and Spine Center is always here to support you through your recovery process.